I'm standing here because people were there at the right people were there at the right time, because they knew what to do, because the fire department people came in a short time, because the EMS people helped me, most of all, the thing I'd like to say about it is because God was watching over me. I realized, that He used people, and I'm very grateful for that, but I'd say the bottom line is that God was watching over me.
Mr. Hickey didn't look like he was feeling well. Maybe he was winded. He was drinking a drink. His hand goes on his head, and it almost looks as if he's seizing. Luckily, a couple of our regular members were nearby, and I was on the phone, and we were all able to, kind of catch him before Mr. Hickey hit the floor.
I do remember sitting down, feeling kind of tired, which was kind of something that I kind of had experienced every time I worked out. I just kind of associated with being old and working out, So I was feeling a little weak and woozy, a little woozy maybe,
We check the pulse. We don't hear any breathing. At that point, we go into chest compressions, and we give some breaths. One of our team members was able to phone 911 and bring over the AED. We get that hooked up. We administer a shock, and the great thing is that we're very fortunate that the Parkersburg Fire Department, Station 5, was able to get here within 6 minutes. So Mr. Hickey hits the floor at 11:22 a.m., and they're in the door working on him at 11:28 a.m.
We were in station. We got toned for a male subject having seizures. We arrived on scene. Personnel met us outside and said that it was a working code. They were doing CPR. Came inside, came around the corner, saw the patient on the floor, heard the AED analyzing, saying shock advised. We see them shock. I immediately let our dispatch know that we now go from a seizures call to a working code, and we go down and do what we're trained to do.
Our response time from when we got turned out to getting here was 2 minutes. It was 6 minutes by the time they called and we got here. The bystanders and the workers here initiating CPR is very crucial. 2 minutes don't seem like a long time until you try to hold your breath for 2 minutes and realize what that patient's going through.
Knowing CPR, doing it correctly, doing it efficiently, and doing it in the timely manner of when the initial person goes down makes all the difference in the world. It's all about the timing.
So Mr. Hickey had come in through our ER. Apparently he had arrested in the field over at a Planet Fitness where the first responders were able to get an AED on him and get him revived and into our hospital, and he was taken emergently to the cath lab from the ER, and the cath lab is where they perform diagnostic testing and potentially therapy, including stents and things like that, and that's all done by cardiologists. He made it to the cath lab, and they were able to determine that he had coronary disease. He had several blockages in his arteries to his heart. Given the degree of blockages and sort of the way he presented to our hospital, pretty sick, I was consulted down to take a look at the films while he was on the table, and did determine that he would be an appropriate candidate for coronary bypass surgery. The surgery went well. He had a little bit of a recovery in the hospital, just given all the stress he had been through, but today I hear he's doing very well and happy, and I did see him a few days ago in the clinic, and he was doing very well and was very appreciative of everything. So,
very grateful to Dr. Bush for the surgery he did. I have a great sense of gratitude, of course, for him saving my life. I remember when I talked to him and thanked him for it, was sort of like, it's what I do, He wasn't looking for a whole lot of praise or anything, but obviously I kind of owe my life to his competence,
Well, we are able to offer comprehensive care from arrival to the ER, then going to the cath lab, our ICU, surgery, and I hear he's even doing outpatient rehab to get stronger right here at Camden Clark as well. So Mr. Hickey had a cardiac arrest because he had a major heart attack, which is caused because he has blockages in his arteries, in his coronary arteries. These are the arteries that supply the heart muscle with the nutrients and the oxygen that the heart muscle needs to function well. So if somebody has blockages and the heart muscle is not getting enough oxygen, not getting enough nutrients, then there's damage, and that's a heart attack. So he had a major heart attack.
Well, it was explained to me that because of the surgery, which was a quadruple bypass from what I understand, that the overall effect of having the surgery was that it was going to be the equivalent of being like having a body that's 20 years younger. So naturally, I'm very happy about that.
The goal of bypass surgery or other techniques such as stenting, which is also useful in select cases, is to get blood back to the heart muscle where it needs to be. In terms of surgery, what we do is we sew either a vein from the leg or an artery found elsewhere in the body, either in the chest or elsewhere. We sew it into the coronary artery past those blockages, and we sew the upper end to the aorta, or the major blood vessel just above the heart, so you're getting new blood flow going around those blockages and to the heart muscle. In Mr. Hickey's case, there's 3 main vessels in the heart, and then there's some side branches, so we actually had blockages in 3 of those vessels and a side branch, so we actually ended up doing 4 bypasses to get blood around those blockages, basically.
I don't even know what the implications would be for having to be flown somewhere, driven somewhere, as far as whether I would have even survived, because given the conditions that I was in, I don't even know if I would have made it, but for sure I'm just glad that it was local, you know.
This is the only cardiac surgery program in the Mid-Ohio Valley, and our partnership with the West Virginia University HVI allows us to be very successful in terms of what we were able to offer patients and some of the resources. This has been a successful cardiac surgery program for several years, and things are only growing and improving. Cardiologist is a medically trained heart doctor. So their goal is to treat heart disease using medicines, using lifestyle changes, and all options essentially short of actual surgery. Now, there are also interventional cardiologists, and these are the cardiologists that perform the catheterization procedures and diagnose heart disease, diagnose where the blockages are, how bad they are, and also potentially treat some of them with stents and appropriate patients for stents. Stents are little mesh devices that are cylindrical, and they deploy inside a blockage and open it up and allow new blood flow through those blockages. What I do is cardiothoracic surgery, and I work very closely with cardiologists. I think that's the thing that drew me to this field in the first place, is the opportunity to have an immediate impact. All physicians try to help people in ways that they can. Some physicians deal with medicines and things that take a while to have an effect. But you know, the main draw for me to cardiac surgery was the effect is immediate and oftentimes life-saving, which is what really appealed to me in the first place.
I was very impressed with the surgery, like I say, which was after the fact for me, knowing about it. The care that I had with the nurses and the doctors there was great. You know, they did a good job taking care of me, monitoring me, and you know, so it was a really good experience at Camden Clark.
As far as our job with the first responders, we get to the scene, we do what we're supposed to do, and then that's it. We don't know afterwards. We don't get to deal with anything other than the actual incident itself. So for us to come here and actually get to meet Mr. Hickey for the first time face to face and standing up talking to us was a real joy.
We were very, very fortunate, very, very, very lucky. Neil has impressed me. He's really surprised me. He's all there, and we welcome him back in the gym as soon as we can. And he's excited to come back. And from the doctors saying how much blockage he had, I think he's going to be a brand new man as far as health and as far as conditioning, and as far as his breath and all that. And we're excited for him.
Of course, I'm grateful that people wanted to help me, and of course they knew what to do, you know.